How can nerve fibers be repaired? If damage is not extensive, the cell body and neurlemma are intact and scarring has not occurred. What are the stages of repair of an axon in a peripheral motor neuron? What is the membrane potential? Slight excess of positively charged ions on the outside of the membrane and slight deficiency of positively charged ions on the inside of the membrane. A polarized membrane is what? A membrane that exhibits a membrane potential. What is the resting membrane potential? Membrane potential maintained by a non-conducting neuron's plasma membrane, typically -70 mV. What is the sodium-potassium pump? An active transport mechanism in plasma membrane that transports Na+ and K+ in opposite directions, and at different rates. Local potentials are defined as slight shift away from the resting membrane in a specific region of the plasma membrane, also called graded potentials. Excitation inhibition. Excitation in nerve impulses refers to when a stimulus triggers the opening of an additional Na+ channels, allowing the membrane potential to move toward zero. Inhibition in nerve impulses refers to when a stimulus triggers the opening of additional K+ channels, increasing the membrane potential. Action potential is what? The membrane potential of neuron that is conducting an impulse, also known as a nerve impulse. Two types of refractory periods. Absolute refractory period, relative refractory period. Absolute refractory period happens during when? A brief during which a local area of a neuron's membrane resists re-stimulation and will not respond to a stimulus, no matter how strong. Relative refractory period happens during when? Time during which the membrane is repolarized and restoring the resting membrane potential will respond only to a very strong stimulus. What are the two types of synapses? Electrical synapses, chemical synapses. Electrical synapses occur where? Occur where cells joined by gap junctions allow an action potential to simply continue along postsynaptic membrane. Chemical synapses occurs where? Occurs where presynaptic cells release chemical transmitters across a tiny gap to the postsynaptic cell, possibly inducing an action potential there. Structure of a chemical synapses is synaptic knob, synaptic cleft, elements of synapses. What is the synaptic cleft? Space between a synaptic knob and the plasma membrane of a postsynaptic neuron. What is the synaptic knob? Tiny bulge at the end of a terminal branch of a presynaptic neuron's axon that contains vesicles housing neurotransmitters. Different arrangements of synapses. Accident-dendritic, axon signals synaptic dendrite. Common axosomatic, axon signals postsynaptic soma. Common, exoaxonic, axon signals postsynaptic axon. May regulate action potential of postsynaptic axon. Plasma membrane has protein molecules that serve as receptors for the neurotransmitters. What are the two types of cardiac cells? Myocardial cells, which are working or mechanical cells and are responsible for contraction, pacemaker cells, which are specialized cells of electrical conduction system and are able to spontaneously generate and conduct impulses. What happens in the myocardial cells when they are electrically stimulated? The myocardial cells contain contractile filaments which slide together when the myocardial cell contracts during stimulation. What are the 5 unique properties of cardiac cells? Automaticity, excitability, conductivity, contractility, refractoriness. Define automaticity. Define excitability. Is the ability of cardiac muscle cells to respond to an outside stimulus. Define conductivity. Define contractility. Is the ability of cardiac cells to shorten, causing cardiac muscle contraction in response to an electrical stimulus. What are some examples of medications that enhance contractility? Digitalis, dopamine, epinephrine. Define refractoriness. The period of recovery that cells need after being discharged before that are able to respond to a stimulus. In the heart, the refractory period is longer than the contraction. What happens during phase 0, also called depolarization, of the cardiac action potential? Rapid influx of sodium and efflux of potassium, also calcium, slowly moves into cells. What does phase 0 correspond to? QRS complex on ECG. What happens during phase 1, also called early repolarization of the cardiac action potential? Influx of sodium and efflux of potassium slow down. What happens during phase 2, also called plateau phase of the cardiac action potential? Slow influx of sodium and efflux of potassium and chloride. What does phase 2 correspond to? ST segment on ECG. What happens during phase 3, also called final rapid repolarization of the cardiac action potential? Influx of sodium and calcium and efflux of potassium. What does phase 3 correspond to? T wave on ECG. What happens during phase 4, also called return to resting state of the cardiac action potential? Absolute refractory, relative refractory. Explain refractoriness. period of recovery that cells beat after being discharged before they are able to respond to a stimulus. Explain the absolute refractory period. Cells cannot be stimulated to conduct an electrical impulse. Does not matter the stimulus. Explain the relative refractory period. Cardiac cells can be stimulated to depolarize if the stimulus is strong enough, corresponds with downslope of T wave. Fast response action potentials occur in cells of the atria, ventricles, and Purkinje fibers. The fast response action potential occurs because of what? The presence of many voltage-sensitive Na+ channels that allow a rapid influx of Na+ when these channels are open and prevent influx when they are closed. The SA and AV nodes do not possess fast sodium channels but possess low calcium and slow sodium channels. Slow action potentials usually occur where and because of what? AV and SA nodes but can occur abnormally anywhere in the heart, usually secondary to ischemia, injury or an electrolyte imbalance. What is the supranormal period? A part of the refractory period is when a weaker than normal stimulus can cause cardiac cells to depolarize. Dysrhythmias can develop during this period, corresponds with end of T wave. What supplies the AV node with its blood supply? Right coronary artery in 85% to 90% of the population, and the left circumflex artery in the remaining 10% to 15%. What is the rate at which the SA node beats at? 60 to 100 beats per minute. What is the rate at which the AV node beats at? 40 to 60 beats per minute. What is the rate at which the Purkinje fibers beats at? 20 to 40 beats per minute. How does the impulse from the SA node reach the AV node? Via internodal pathways which consist of anterior, middle, and posterior pathways. What are some causes of dysrhythmias? What are the standard limb leads? Leads 1, 2, and 3, right arm electrode is always negative, left leg electrode is always positive. What does lead 1 record? The difference between left arm and right arm electrodes, views lateral wall of left ventricle. What does lead 2 record? The difference in electrical potential between left leg and right arm electrodes, views inferior surface of left ventricle. What does lead 3 record? The difference in electrical potential between left leg and left arm electrodes, views inferior surface of left ventricle. When looking at an ECG, what is the length of time of the width of each small box? 0.04 seconds. When looking at an ECG, what is the length of time of the width of each large box? 0.20 seconds. Relative to an ECG, What is the baseline, also called the isoelectric line? Straight line, no electrical activity detected. Relative to an ECG, what is the waveform? Movement away from the baseline X. Wave. Relative to an ECG, what is a segment? Line between waveforms. Relative to an ECG, what is an interval? Waveform and segment, section between waves. Relative to an ECG, what is complex? Several waveforms. If there is a peak T wave, what are you considering? Hyperkalemia. If there is no T wave, what are you considering? Hypokalemia. What is a sign of a wandering atrial pacemaker? 3 different P waves. What makes of the Samter's triad? Nasal polyps, asthma, aspirin intolerance. What characterizes Bessel-Gerish reflex? Bradycardia, hypotension, apnea. What is the meaning of the oxygen dissociation curve? The relation between the partial pressure of oxygen and the oxygen saturation. Hemoglobin's affinity for oxygen increases as successive molecules of oxygen bind. If the wave of depolarization moves towards the positive electrode, how does the ECG record the waveform? Upright. If the wave of depolarization moves towards the negative electrode, how does the ECG record the waveform? Upside down/inverted. Regarding the wave of depolarization, when do you see a biphasic waveform? When the wave of depolarization moves perpendicularly to the positive electrode. What does the P wave represent? Atrial depolarization, spread of impulse throughout right and left atria. What does the QRS complex represent, from Q wave to J point? Ventricular depolarization and atria repolarization, spread of electrical impulse throughout the atria. What does the Q wave represent, the first downward deflection following the P wave? Depolarization of interventricular septum. What is the normal duration of the QRS complex? 0.06 seconds to 0.10 sec. Abnormal is anything greater than 0.12 seconds. What does the T wave represent? Ventricular repolarization, absolute refractory period still present, relative refractory period starts at peak of T wave. What does a negative/inverted T wave suggest? Myocardial ischemia. What does seeing a cerebral T wave mean? Patient has a subarachnoid hemorrhage. What does the U wave represent? Repolarization of Purkinje fibers. An abnormal U wave, which is when the U wave is more than 1.5 mm in height, may be a result of what? Electrolyte imbalance, medication, hyperthyroidism, central nervous system disease, long QT syndrome. If there's an elevation in the ST segment, what can that mean? Acute myocardial infarction. If there's a depression in the ST segment, what can that mean? Ischemia or hypokalemia. How long is the PR interval? 0.12 seconds to 0.20 sec, reflects depolarization of atria and the spread of impulse through AV node, bundle of his, right, and left bundle branches and Purkinje fibers. Where's the PR interval? Begins at onset of P wave and ends at onset of QRS complex. What can a prolonger's PR interval be seen in? First-degree avenue block, hypothyroidism, digitalis toxicity. What does the QT interval represent? Total ventricular activity, time from ventricular depolarization to repolarization. Measured from beginning of QRS complex to end of T wave. How long do the QT interval generally last? 0.32 seconds to 0.38 sec. What does the R to R interval determine? Ventricular rate and regularity of rhythm. What does the P to P interval determine? Atria rate and regularity. What is an artifact? Distortion of an ECG tracing by electrical activity that is non-cardiac in origin, can mimic various cardiac dysrhythmias including ventricular fibrillation. What can cause an artifact? Loose electrodes, broken ECG cables or broken wires, muscle tremor, patient movement, external chest compressions, 60-cycle interference. Right arm electrode is always positive? False, negative. Left leg electrode is always positive? True. If there is no P wave, what does that mean? The impulse originated in the AV junction. What does a tau/peak T wave commonly mean? Hyperkalemia. What is the position of V1 and what part of the heart is viewed here? Positioned on right side of the sternum, fourth intercostal space. The septum is viewed here. What is the position of V2 and what part of the heart is viewed here? Positioned on left side of the sternum, fourth intercostal space. The septum is viewed here. What is the position of V3 and what part of the heart is viewed here? Positioned midway between V2 and V4. The anterior surface is viewed here. What is the position of V4 and what part of the heart is viewed here? Positioned on left midclavicular line, fifth intercostal space. The anterior surface is viewed here. What is the position of V5 and what part of the heart is viewed here? Positioned on left anterior axillary line. Same level as V4. The lateral surface is viewed here. What is the position of V6 and what part of the heart is viewed here? Positioned on left metaxillary line. Same level as V4. The lateral surface is viewed here. If right ventricular myocardial infarction is suspected, how do you set up your leads? Same as on left, but on the right side of the chest. To view posterior surface of the heart, where do you place your leads? V7 equal posterior axillary line, V8 equal posterior scapular line, V9 equal left border of spine. What is the MCL1 lead? Variation of the V1 lead and views the ventricular septum, and the negative electrode is placed below the left clavicle toward the left shoulder, and the positive electrode is placed to the right of the sternum in the fourth intercostal space. What is the MCL6 lead? Variation of the V6 lead and views the low lateral wall of left ventricle, and the negative electrode is placed below the left clavicle toward left shoulder, and the positive electrode is placed in the fifth intercostal space, left metaxillary line. Which leads view the inferior heart surface?